Development. The Charter is a call to action that asks countries and partners to commit to 5 actions. First, to connect the dots between policies on patient safety and health worker safety. Second, to develop and implement national programs for the occupational health and safety of health workers. Third, to protect health workers from violence in the workplace. Fourth, to improve the mental health and psychological well-being of health workers. And fifth, to protect health workers from physical and biological hazards. No country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe. Now, more than ever, we have a duty to give health workers the safe working conditions, the training, the pay, and the respect they deserve. I would now like to give the floor to my friend, Jeremy Hunt, who has been a long-term advocate for patient safety. Jeremy, thank you for your support, your leadership, and your passion for patient safety. You have the floor.
Thank you, Dr. Tedros. Good morning, good afternoon, good evening, everyone. It's a great pleasure to be with you today. And Dr. Tedros, your personal commitment to improving safety for patients has been outstanding, as I discovered during my time as UK Foreign Secretary and UK Health Secretary. And I want to take this opportunity to thank you too for your leadership during the COVID crisis. The Economist this week saluted you for visiting the Congo 14 times during the Ebola epidemic there. And everyone who's worked closely with you knows how personal your commitment is to the safety and well-being of both patients and staff. And it's no coincidence that under your leadership, we had the first World Patient Safety Day last year. Today's the second. And I'd also like to thank your wonderful team, Susanna, Ed, and Neelam, many others who've worked very hard to make today possible. Also, I'm delighted that we have Guy Ryder from the ILO with us in recognition of our theme this year, health worker safety. When I was a UK Health Secretary, I had to respond to a series of scandals where poor quality care resulted in the needless deaths of patients. They were heartbreaking stories. And I learned how common avoidable harm and death is in all healthcare systems. 5 avoidable deaths every minute across the world, according to the WHO, making it a bigger killer than HIV, malaria, and TB combined. And I learned something else. No one wants to tackle this more than our doctors and nurses. But because they're often threatened with losing their job, their license to practice, their professional reputation, or litigation, they often find it impossible to speak openly about the ordinary human error that is inevitably part of their lives, just as it's part of all of our lives. So we need to make it easier for people to be open and transparent about the things that go wrong so that we can avoid tragedies being repeated. And the thing that has distressed those frontline health workers most in this pandemic year has been the worry that they may be passing on coronavirus to their own patients. Given that about 70% of virus carriers are asymptomatic, that is a real risk. We've had some London hospitals where over 40% of staff were infected at one point. And up to 11% of our deaths from COVID in the UK were of patients who caught their infection inside a hospital. If that was the same worldwide, it would suggest up to 45,000 patient deaths and up to 7,000 health worker deaths were caused because we did not give staff the safety protection they needed. So this is a very, very important theme, because patient safety and staff safety are 2 sides of the same coin. Catching COVID-19 in a healthcare setting should be a never event, something that simply never happens. because both patients and staff have a right to be safe and to expect to be safe when they go to a hospital or healthcare setting. So today's charter and 5 goals will help make that happen. Those goals, as you said, Dr. Tedros, are to reduce sharp injuries, collect data on safety-related deaths, reduce workplace stress and burnout, improve personal protection practices, and adopt zero tolerance of violence towards healthcare staff. They all help improve the mental and physical safety of health workers and the safety of patients too. So I therefore call on all WHO members and all healthcare organizations worldwide to sign this charter, to pledge your support to these goals. Together we can keep our healthcare workers safe and keep our patients safe in this time of crisis. Thank you.
Thank you so much, Jeremy. Much gratitude for your continued support. And as you have rightly said, as Health Secretary of the UK and as Foreign Secretary of the UK, and even after that, your passion, your commitment to patient safety is very, very inspiring to all of us. And thank you so much for that passion and commitment, for your leadership. And thank you for joining today, and I hope you will stay with us to address the questions from our journalists who have joined today. And now I will I would like to hand over to my friend, Guy Ryder, and you have the floor.
These most difficult times. We admire that leadership in the international system, and like everybody else in the system, we benefit from it as well. Secondly, I want to echo the United Nations General Assembly in its tribute by the resolution it adopted last Friday to health workers and to all other frontline and essential workers for their role in addressing the pandemic, and in addition its emphasis on the need to provide them with the necessary protection and support. And the third message is to welcome very warmly the charter that's being launched today on health worker safety and the 5 actions that it sets out. And let me assure you, Dr. Tedros, that the ILO will be ready to do its bit in their realization. The COVID-19 pandemic has highlighted the obvious and close interaction between our health and the work that we do. In responding to it, we do not have to choose between work and health or life and livelihood. These are propositions that we share, Director General. We know that these 2 aspects depend intimately on each other, and despite the complex policy challenges that this raises, it's a basic truth. And by the same token, the charter that we are launching today sets out an agenda for action inspired by the conviction, which Mr. Hunt has just reiterated, that patient safety requires guarantees of health worker safety as well. 2 sides of the same coin. Regrettably, too often, those guarantees are missing. The Charter points out that it is a basic tenet of the Universal Declaration of Human Rights that all people have a right to just and favourable conditions at work. But it is a harsh and all too frequently forgotten reality of our world of work that no less than 2.3 million people die every year because of the work that they do through occupational injury, disease and accident. Ironically, tragically, the working people whose job it is to care for and to treat those victims also figure prominently amongst their number. And Brother Tedros, the figures that you have cited in your introduction is shocking testimony to that in these times of COVID-19. And as the Charter makes clear, and I think it's one of its most important contributions, the hazards that health workers face extend well beyond the physical and biological ones that are so clearly evident today to those of mental health and psychological welfare, and even acts of violence, harassment and discrimination. And in a worldwide workforce which is so highly feminized, where migrant workers are so strongly present, we need also to be acutely conscious of the need to provide protections in those areas. The Charter is also a call to act through national programs that address in an integral way all of these different areas of risk and hazard. And I repeat that the ILO will, as it must, respond with the WHO to that challenge. We can bring to the task not only the governments whose membership we share in our two organisations, but also in the case of the ILO, the workers' representatives and employer representatives who make up part of our membership. But allow me to add as well that it is my belief that to be successful in these critically important endeavours, we will also need to address the structural challenges to the healthcare sector on which the WHO, ILO, and indeed the OECD have been cooperating for many years, particularly in the context of the follow-up to the recommendations of the United Nations High-Level Commission on Health, Employment and Economic Growth. And these point to underlying problems arising from the overburdened and underfunded public health systems in many countries, unacceptable working conditions, and the global shortage of health workers, which is estimated will stand at 18 million worldwide by the year 2030, which is when we're supposed to deliver on SDG 3, the health goal of the UN Sustainable Development Agenda, and all of the other 16 goals. So in conclusion, it seems to me that paying tribute to the courage, dedication and skills of health workers, acknowledging their contribution and that it is widely undervalued and underpaid, under-rewarded, surely carries with it the obligation to act to do something to bring change to these circumstances. Today, with the Charter, we are given the chance to act. We are given an instrument that, if we take seriously, will rebound to the benefit of patients, health workers, and our societies. Director General, the WHO and the ILO are very close neighbours physically here in Geneva. We work well together, and despite your unrelenting calls for us to keep a safe distance apart these days, I trust that delivering together on this Charter will bring us a little bit closer. Thank you very much.
Thank you so much, Guy. Delivering together is I think, the most important. So look forward to working with you even more closely to deliver result. So with that, back to you, Fadila. Thank you.
Thank you, Dr. Tedros. Thank you, Mr. Hunt, Mr. Ryder. I will now open the floor to questions from the press. I would remind our journalists that you need to raise your hand. Use the raise your hand icon in order to get in the queue to ask questions. I would recommend we prioritize questions on the theme of the day, patient safety, health workers safety. We have with us today Gabriela Sotomayor from Proceso. Gabriela, you have the floor. Can you hear me?
Yes. Can you hear me?
Very well, Gabriela. Go ahead, please.
Thank you very, very much for giving me the question. It's nice to see you, Mr. Ryder, there as well. So my question is, if governments must be held accountable for the deaths of health and essential workers who they have failed to protect from COVID. Thank you very much.
Mr. Ryder, you have the floor.
Thank you very much for the question. Look, the way I look at this is that there is really not a important distinction in terms of responsibilities of government or indeed other actors in the world of work between the health and safety of health workers and those of other workers, and I've tried to point to the overall problem that we face. The point here is, yes, there is responsibility in government, but I think the most important angle to approach these issues is on what we can all do together to improve a situation which is eminently improvable. It lies within our capacities, governments, employers, workers' representatives, to actually bring about improvements in the health and safety of healthcare workers. You know, there is really no magic in this situation. We simply have not applied the right attention, the right priorities, and here I speak across the board, to the task of ensuring worker health and safety. The figures are an indictment of past failures of all of us, and the Charter, again, I think, serves the purpose of focusing our minds on business which has been pending for a very long while, which the pandemic has highlighted in different ways, but it's not new. It's not new, and the solutions are not new. The Charter, I think, provides us with very important guidelines for the specifics of the health sector, but there are more broadly applicable principles at work here as well.
Thank you, Mr. Ryder. I think Dr. Edward Kelly would like to add something. Edward?
Just to add to Guy's very good intervention, from the WHO's stance and from the Charter's perspective, we lay out not just the infections and deaths that have occurred in this outbreak. Exactly as Guy said, the outbreak, we've said many times, has not created new problems for us. It's shown a light on some of these problems, and health worker safety, as part of patient safety, is a key one in that. But it goes beyond just infections in healthcare settings. We talk about attacks against health workers and a wide range mental health issues. In 2019, there were over 1,000 confirmed attacks on healthcare workers. These are the types of issues that governments should also be concerned with and should also address.
Thank you, Dr. Kelly. I would like now to give the floor to Laurent Serrault from the Swiss News Agency. Laurent, can you hear me?
Yes, can you hear me, Fadela?
Very well, Laurent. Go ahead, please.
Yeah, thank you for taking my question. Actually, it's a follow-up on what Mr. Kelly just said, because in international humanitarian law, targeting health workers is considered as a war crime. So would you recommend a special and stronger provision in national criminal acts in order to punish violence against health workers? And maybe Jeremy Hunt could also address that, what he would consider for UK. Thank you.
We will start maybe with Mr. Hunt. Mr. Hunt, you have the floor.
I would absolutely support that. I mean, to me, I'm not a doctor, a nurse, a clinician. I think these are people who are putting their lives on the line to keep us, members of the public, safe. And I think when they suffer violence or discrimination or are put in danger by things that are done by the people that they're trying to protect, it is totally and utterly unacceptable. And I think the penalties should be higher than normal, yes.
Thank you, Mr. Hunt. Dr. Kelly?
Just to complement Jeremy's very good intervention, from WHO's standpoint, we don't sort of engage on the legal aspects of this. It's not our particular remit, but we have many initiatives around this. The Attacks Against Healthcare initiative, we have surveillance on this. For the Charter and the particular message for World Patient Safety Day, it's about what we can do together to stop these before they happen, and address with national governments and also with local organizations and with the community. WHO defines attacks on healthcare workers not just as physical attacks, but verbal attacks and mental abuse. So we've had many stories during this outbreak of the misunderstanding that communities have around the disease being at the heart of fear and abuse towards healthcare workers, and that's something we can work on all together.
Thank you. Mr. Ryder?
Just to add and to draw attention to the fact that the ILO adopted a convention on the elimination of violence and harassment at work last June, in June of last year. It's the first international labour standard to address the problem of violence and harassment at work. Its existence, I think, demonstrates just how widespread a problem this is, and it does provide for, in a quite detailed way, sanctions and remedies for this type of situation, as well as preventive action. We would like to see countries around the world ratifying and applying that convention. I think it would go a considerable way to addressing the types of issues that have been raised by the questioner.
Thank you, Mr. Ryder. We received some questions in writing. I will ask to elaborate more about the linkages between patient safety and health worker safety. The DG mentioned it in his speech. Maybe Neelam Dhingra, Dr. Neelam, can you elaborate on this issue, please?
Thank you very much. As has been elaborated, that health worker safety and patient safety are two sides of a coin. It's extremely important that health workers feel secure and have a decent working environment and be provided with protection from psychological pressures as well as working conditions where their working hours are considered. So overall stress and long working hours, strained relationship with colleagues, poor teamwork, all these contribute to high level of stress and burnout of health workers. And those who are under pressure, psychological pressure, are more prone to make errors. There are several studies which have shown significant impact on weaknesses in health worker safety having impact on patient safety, particularly the systems variables. And I would just like to highlight one very important underlying factor, which is the culture where the health workers operate. It's extremely important for healthcare leaders to provide a safety culture, a culture which is open and transparent, where health workers can share their concerns, where patients' voices are also taken in full consideration. Patients and health workers work very closely together to develop policies and guidelines, and they are true partners in developing and implementing the policies. So I would say one extremely important strategy to improve health worker safety and patient safety is creation and establishment of safety culture across all health organizations, where there's an open and transparency in communication, and the risks to safety are shared with colleagues and with senior leadership so that corrective actions could be taken. Thank you.
Thank you, Dr. Dhingra. We received also a question via our social media networks. There is a need for a mental health program to support workers, especially those who have lost colleagues to this pandemic. Who would like to react to this question? Do we need a program to support people who, and health workers who lost their colleagues? Dr. Kelly, would you like to elaborate on this?
Yeah, I'll add, and maybe Maria wants to comment. It's something that we have looked at in the response for COVID. It's an important piece of our examination of the continuity of essential services, but also the investigation of the effects on health workers and the changing work environment. But I should also point out that it's an ongoing piece of work for WHO's quote-unquote peacetime areas, and our mental health program does look at both the effects of stress and overwork, not just in the health sector, but elsewhere. And we have a strong occupational health program that works in collaboration with our colleagues at ILO, looking at these types of issues. For sure, this is an important issue, and for sure, countries and organizations and health facilities should be looking at the importance of mental health as a way of ensuring that essential services keep running. So this is something WHO would strongly support.
Thank you, Dr. Kelly. Maria, do you have something to add?
Sure, yes, absolutely. I mean, fully support what Dr. Kelly just said. Absolutely, mental health, psychosocial support for frontline workers, all health workers, whether you're in hospitals or you're community health workers, you know, performing this function particularly in this pandemic, but in all of the services that you provide. I think just to take a moment to say some of the other things that we're doing to support health workers in this pandemic as part of the response may be helpful as well. So from the standpoint of WHO, and we're working with many partners to improve the conditions, and please supplement, because there's so many different groups within WHO and our partners that are working on this. The first thing that we focus on, which my team is responsible for, is around this technical guidance around protecting health workers on what they need to do when they're caring for patients. So this is infection prevention and control type of guidance, which is how you care for patients safely to prevent yourself from getting infected and from passing the virus around. We also provide guidance for care in the home, because many individuals who have mild disease or who are not at risk of developing severe disease can be safely cared for at home with the right provisions, and so there's care that needs to be provided there. The use of PPE, personal protective equipment, making sure that the right personal protective equipment is provided. There's training of how it should be used, safely worn, safely disposed of, for different areas of activity within different types of health facilities. We provide a lot of trainings because it's about how not only providing the guidance itself, but training frontline workers. Many individuals, many health workers are now working on respiratory diseases like COVID, who hadn't been working on this previously. It's been pulled from different departments to support the response. And so it's very important that there's trainings. And we have these trainings online in numerous languages. And we are adding more languages every week because we realize this is a global issue and we need to make sure that the trainings are accessible in different languages. The third area is looking around increased surveillance and screenings for health workers to really understand the extent of this issue, extent of infection, the extent of the risk. And so countries are working very hard to incorporate this into the surveillance activities. The fourth area is around research. And so we specifically are conducting research and working with partners to conduct research for health workers to again understand the extent of infection or the risk of infection, and what are those risk factors? You know, how are they getting infected? Where are they getting infected? And what can we do to prevent that from happening? And we've learned a lot in this area, and we are seeing some promising trends in reduced infections for COVID-19 over time, and that's a good sign. And the last area is increasing access to supplies. So it's not only good to say, please wear this type of PPE, we need to ensure that those supplies are reaching the health workers all over the world. They cannot be distributed to only some countries, they need to be distributed to all. And we've worked very hard with partners to be able to access and source those supplies and make sure that they get on planes and enter countries and actually get into the hands of those who need it most. Thanks.
Thank you, Maria. Any other intervention? Mr. Hunt, do you want to add something? No. No.
I just want to make one very brief point, if I may, which is about PTSD and the fact that, you know, it's increasingly becoming clear that having gone through a peak of pressure during the height of the pandemic, a lot of frontline health workers are suffering after effects, particularly in areas where there weren't enough hospital beds or ventilators. And certainly that's something that we've been focusing on a lot in the UK. And then the other thing I wanted to say is that I think in a lot of countries, there's been a huge amount of gratitude expressed to health workers in hospitals. But I think we also need to remember the care sector and the pressure on health workers in care homes or looking after older people in their own homes. They often don't get the appreciation that they should for the incredibly important contribution they make.
Thank you very much, Mr. Hunt. I think Dr. Dhingra would like to add something.
Thank you very much. I just want to once again wish everybody a very happy World Patient Safety Day. And I must say that this day has provided a huge platform for change. And across the world, there are several national and international initiatives, and countries have really taken up this issue of health worker safety as a priority. And it is actually a beginning of a movement on health worker safety. So very proud to be associated with DAY, and thank you very much for that.
Thank you, Dr. Dhingra. We have Jamie Keaton from Associated Press. Jamie, can you hear me?
Yes, I can. Thank you, Fidela.
Thank you, Jamie.
This is for Dr. Tedros. Dr. Tedros, how much should governments be held accountable for mixed messages? Yesterday, we had Dr. Redfield, who made an assessment that masks could be more protective than vaccines. President Trump said that mass vaccinations will start next month. And he also said that many people don't think that masks are that good, many people. So my question, are masks more protective than vaccines? And when can mass vaccination start? And are many people right when they think that masks aren't good? What does WHO have to say about that?
Thanks. Thank you, Jamie. I think Maria would like to intervene. Maria?
Thanks, Jamie. I can start, and maybe others would like to add. We recommend a comprehensive set of packages to tackle this pandemic. We know that there are so many things work in preventing transmission, reducing transmission, suppressing transmission, controlling this outbreak. Masks are part of that, and they are part of the individual measures that people can take, including physical distancing, including hand hygiene, including respiratory etiquette, masks where appropriate, making sure you follow the guidance and stay home if you're unwell, seek care if you need, the public health measures that are put in place, active case finding, caring for isolation of cases, caring for cases depending on the severity of their symptoms, comprehensive contact tracing, quarantining of contacts. There's a lot of measures that are put in place, and it's really important that people understand that there's a lot that we can do, and there's a lot that individuals can do as well in terms of taking a risk-based approach to their day and how they go out about their day.
Thank you, Maria. Dr. Ryan?
Yes, good morning. Good afternoon, everyone. Yeah, I think it is important that we have consistent messaging from all levels, and it's not for one country or one entity, or consistent messaging between science and between government, consistent messaging across all of the different topics here. This is complicated stuff. Data changes, information changes, evidence changes. So it isn't easy, and it isn't easy for everyone to be on message all of the time. But what it is important is that governments, scientific institutions step back, review the evidence, and give the most comprehensive, easy to understand and digest information so that people can take the appropriate action. We also need to look at the tools we have now. And the tools we have now is what we have. We hope, and we dearly hope, and we are working very hard under the leadership of Dr. Tedros to drive the development of safe and effective vaccines. But we don't have those vaccines now. What we do have are well-tested strategies that we know work. Dr. Tedros says, you know, not one thing. It's not just about masks. It's not just about physical distancing. It's not just about avoiding crowded spaces. It's not just about hand hygiene. It's about all of those things. Do it all. Governments need to get that message across and continue to get that message across to communities, and they need to empower communities to take action. There's nothing worse than being told to do something that you cannot do because you don't have the resources, you don't have the education, you don't have the knowledge. There's a process of transferring knowledge to people. It's not just shouting at them. It's communicating with them. It's engaging them. It's understanding the confusions. It's understanding their concerns. It's understanding their apprehension and not laughing at it and not turning that into some kind of political football. It's about genuinely communicating with people and genuinely recognizing that it's confusing and it's upsetting. And it's something we all strive to do better at. We all need to strive to do better with that. Everyone, politicians, scientists, doctors, nurses, parents, teachers, everyone needs to become a communicator and take that responsibility seriously. And just while I have the floor on the issue of health workers, there are three things that haunt health workers working in the front line, particularly in infectious disease. One is to stand there and watch people die because you can't help them. Two is to see a worker fall and be infected, your fellow worker, a friend. And the third, and the one that really preys on health workers most of the time in these situations, is the chance they could take that disease home to their families, to their friends, to their children. So workers are frontline workers are working under immense pressure, under immense strain, and they're extremely courageous. The least we can do is give them the tools, the training, and the environments in which they can do that work at the safest possible level. Because when you feel safe, you do better. When you feel safe, your performance increases. That's what we want: highly performant, highly skilled health workers operating in an environment where they can turn all of their knowledge into solutions for their patients. If they're concerned about their safety, if they're worried about that, they will not perform as well. So even if we want to make this a cold, logical argument, a protected health worker is a more effective health worker. And let's focus on that within the Charter in the coming months. Thank you.
Thank you, Dr. Ryan. We have Imogen Folks from the BBC. Imogen, can you hear me? Imogen?
Yes, I can. Hi, can you hear me?
Yes, I can, perfectly. Go ahead, please, Imogen.
It's also a question about patient safety, and it's related to elderly people, possibly with dementia in care facilities, or younger people who also, because of their health condition, needs to be in long-term care facilities. In many countries, these people have been basically isolated since March. They're not getting the visits, the stimulation that they need. And this is, I have personal experience of this. This is a huge damage to the welfare of patients. What guidelines can you give? I mean, I don't think you can keep an old person with dementia just sitting in their room, not even eating with fellow patients for months and months on end with no visits. And that is what's been happening in the UK, as I'm sure Jeremy Hunt knows.
Thank you, Imogen. Mr. Hunt, do you want to start?
Well, I think that is a massive concern, and we had some very powerful testimony to the Select Committee from a lady whose husband has dementia, and she'd been unable to see him during the lockdown, and she was worried that when she was eventually allowed to see him, her husband wouldn't recognize her anymore. And these are heartbreaking stories. Obviously, infection prevention and control in care homes is essential, and that's one of the things that we didn't get totally right in the UK at the start of the pandemic. I think the solution to this is much more widespread testing, so that we can get people who want to visit relatives in care homes a test, so that they know that they're not carrying the virus, and that therefore the chance of passing it on to someone in the home is reduced. These systems are not foolproof. We've got big issues with testing capacity in the UK at the moment, as I know they do in many places. But that, to me, is the long-term solution of dealing with those issues of isolation.
Thank you, Mr. Hunt. Dr. Kelly?
Yeah, and I can only just compliment Jeremy's very good intervention to say that Imogen, I think, as someone whose father was in a care home, mother-in-law now, her Parkinson's and dementia getting much worse because of the isolation that she has in a care home in the United States. And many of us around the table struggling with this, all of this hits home very personally, I think. And WHO has recognized the immediate priorities around preventing the sort of acute situation. Infections in care homes have caused an inordinate number of deaths. It spreads very quickly because of the residential living facilities, because of common eating areas and all sorts of other things. And providing infection prevention where you have these types of situations is difficult, but is not just about infection prevention as people go in and out of residents' rooms. You have a workforce that tends to be very different than other types of healthcare workforce. They tend to be contract workers. It's a much more fractured part of the healthcare system as someone who directs essential health services for WHO. And it's one that we have, unfortunately, probably as a global community, neglected for a long time. Several weeks ago, the Director General made a call to the rest of the world saying the idea and the treatment of elderly deaths and elderly morbidity and mortality as something different from that of the rest of the population is a moral gap that we have. And this is something that WHO has come out with guidance on it. We have guidance on long-term care and how to manage it. It's not just about how to control the infections, but it's about ensuring the essential services continue, ensuring that facilities try to support residents in terms of mental and physical health as well. So it's a priority that we have and one that needs more work.
Thank you, Dr. Kelly. Dr. Dhingra?
Thank you. The World Health Assembly in 2019 adopted a resolution on global action on patient safety, which clearly identifies the need for safety principles to be applied across all healthcare settings, including mental health services. And aligned with that, WHO has been working on guidelines for safety and quality in mental health services. So just specifically to answer the question which you asked about whether there are guidelines available, but I must say that we have a long way to go to improve patient safety in these services. However, it's well recognized that this is the part of services where we need to prioritize and emphasize, particularly learning from the experience during the COVID pandemic. Thank you.
Thank you, Dr. Dhingra. We have one question through our social media platform about protecting nurses who are doing considerable work in communities, more often overloaded by carrying out work that should be done by doctors. What is your position on the nurses working in the communities, and how can you protect them? Dr. Kelly?
Yeah, I'll start because I'm sure this is something that literally everyone around this table is interested in. It's the year of the nurse and the midwife for WHO. It's something that really flows out of the UN High-Level Commission that Guy mentioned earlier, but it's also part of our work this year with our chief nurse and Dr. Tedros' leadership on this. So it's quite clear that how should we put it, the systems, the health systems of the world are in many ways carried on the backs of the nurse workforce around the world, the nurse and midwife. And healthcare also, we have certain ideas around it being in an office, in a facility, but most care happens outside of that facility, happens in the community, with community health workers, with nurses going out into the community, and also happens with families, with mothers and fathers taking care of their children, with other caregivers. So in this current pandemic, where we are recognizing this particular year of the nurse and midwife, for sure it is an opportunity to emphasize that role, but we have guidance also that we've come out with for how to safely carry out community services, community outreach services, whether this be handing out bed nets for malaria, whether it be catching up on immunization programs, important programs that have been somewhat interrupted perhaps by the pandemic. But the ongoing issue of what we term technically task shifting in the health workforce world is an important one, and one that will continue as we get more and more specialized at the high end of our healthcare delivery. And yet, most of the world's problems are solved by primary health care and by community services that are given. So the countries right now, WHO is pivoting a bit. We still have lots of areas of this outbreak we don't understand, that we're doing more work and more guidance, the science that Maria mentioned. But we are trying to pivot to look more directly at how we can support countries in their work. And this has to be probably one of the top priorities. How can we support the delivery of community health services and primary care in the context of COVID?
Thank you, Dr. Kelly. Dr. Ryan?
Yeah, I think we should truly celebrate frontline community nurses and midwives, public health nurses. I come from a country where public health nurses have been the bedrock of our health system for many years, and in my country and many countries around the world, the first person that a child sees in its lifetime is usually a public health nurse or midwife, and the last person they see is a public health nurse doing end-of-life care, and they're there all the way in between. So and it does speak to sometimes, and I'll say this, I hope I'm not being too controversial, we should and we do celebrate sophisticated hospital-based medicine. It's huge, it's cutting edge, it takes us to the next level of care. But sometimes we forget around the lives that are saved in communities by community workers. We see that also now with public health. We're doing better at saving lives in intensive care units. We're not doing a whole lot better at doing public health surveillance and contact tracing and community education and outreach. We not overinvest. We should always invest in our tertiary healthcare system. We should always invest in sophisticated medicine. But sometimes we forget to make the small, persistent, long-term investments in primary healthcare, in community health, in prevention, and in supporting our communities. And I think when we get through the end of this pandemic, I hope we sit down and have a really tough conversation with ourselves around what is the balance of our investments in health. Because some of the negative impacts of this pandemic are definitely been driven because we do not invest enough in frontline community health and in public health and in primary health care. And it is the bedrock, Dr. Tedros says it all the time, primary health care is the bedrock of universal health coverage. And our public health nurses, our public health doctors, our public health midwives are the bedrock of that system as well.
Thank you, Dr. Ryan. We are up to the hour. Maybe I can invite Dr. Kelly, I think, has something to add. Dr. Kelly.
I'm sorry to take the floor again. Really, it's the problem when you get an Irishman and an Irish American together in the same room. We could just be here by ourselves probably. But it's just to say, one, to come back to the day just briefly, which is, you know, this World Patient Safety Day, where we are really looking at health worker safety and patient safety. We actually had a discussion at one point where someone asked me, well, aren't these like two separate things, and will it confuse people that they're together? And we've talked about this. Neelam has led this work heading in for the day with Dr. Tedros and Jeremy as the co-chair of the steering committee for a long time. And for me, I got involved in global health because of patient safety. My mother died in the best health hospital in New York City from a healthcare-associated infection and subsequent sepsis. And the reason that once it was investigated was because the staff were overworked, undercapacitated, and they were improper and not properly implementing IPC infection prevention and control measures. So the idea that health worker safety and patient safety are part of the same agenda is of highest priority to WHO. It is for sure one of the ways that we will ensure the success both of this day and as it goes forward. And today and the charter are a day and in some ways a piece of paper, but the work really goes on through the year. There'll be the Global Action Plan for Patient Safety that goes to the World Health Assembly next year. There's going to be a whole bunch of work of countries around the world raising awareness today, lighting up things in orange, but also doing work with local communities and local leaders. So it's just to come back to this idea that for today on health worker safety in partnership with ILO and others, that this kind of work needs to go forward and it can make a big difference.
Thank you, Dr. Kelly. I would like to invite Mr. Hunt if you want to give some closing remarks. Mr. Hunt.
I'm very happy to do that. Thank you so much. And I just want to thank everyone at the WHO for the tremendous support that they've shown for the patient safety agenda over recent years. And in some ways, avoidable harm and death in healthcare systems has been a hidden killer. It's been something that we haven't wanted to talk about. Everyone knows how many people die every year from cancer, heart disease, malaria, and so on. But the number of people who die because proper procedures aren't followed, medical error, is something we haven't wanted to talk about. But because of the great efforts of the people that we've heard from today, this is really starting to change. And this is a year with this horrible pandemic where people are understanding that avoidable death in healthcare settings is unfortunately a reality. So my plea to everyone is, when we finally get this horrific pandemic behind us, when we get that vaccine, then that bell, by the way, is the House of Commons in the UK, so please ignore it. But when we get that vaccine and we put this pandemic behind us, please let's not forget that avoidable death continues, and there is so much we can do to tackle the 5 avoidable deaths we have every single minute somewhere in the world. And that's why I think the really important thing, this is the second World Patient Safety Day, but we are putting together a 10-year program to tackle patient safety in healthcare systems across the world, focusing on different themes every year. And it's absolutely right that this year we're focusing on healthcare worker safety, because that's where it all starts. But let's not forget there are many other safety issues to tackle going forward. So thank you everyone for your tremendous commitment to this cause, to you, Dr. Tedros, without whom none of this would have happened, and to your team. And let's use this as a big step forward in a global campaign to prevent the scandal of avoidable harm and death.
Thank you so much, Mr. Hunt. Mr. Ryder.
Yeah, listening to this, this conversation of questions and answers, it's actually quite remarkable the extent to which the issues that have been addressed, and I think they overspill the immediate issues of patient safety and health worker safety, our immediate circumstances of the pandemic. It is remarkable how many of the issues that have come into the conversation resonate very, very strongly with the types of issues that we're trying to deal with day in, day out across the road at the International Labour Organization. So, when I hear, the brilliant colleagues at the World Health Organization emphasize, well, the mental and psychological hazards at work, which I think are a tip of an iceberg that we're uncovering now. When it's said very clearly and very eloquently, that when a worker, a health worker or any other worker, feels safe and treated decently, able to express their views, they perform better apart from anything else. I mean, these are issues which are fundamental to what we do. The whole future of the care economy, which, spills beyond perhaps our immediate categories of thought and analysis. These are things which are, bread and butter issues for the International Labour Organization and the world of work. So looking forward to that day when we can look backwards at this pandemic as something which belongs to the past. I hope we can pick up these threads and bring them together and weave them into something which is important, I think, for the future of healthcare in the world, and very important for the future of work as well. So thank you very much for including me in today.
Thanks to you, Mr. Ryder. I will let Dr. Tedros finish. Dr. Tedros, you have the floor.
Thank you. So after Jeremy and Guy, I think my life is easier to, I would like to say I fully concur with what they have said, and I don't want to repeat what they have said actually, and I fully concur. And I would like also to, on behalf of all our colleagues, Jeremy, Guy, and all my colleagues here, and on behalf of WHO, we would like to express our respect and greatest respect and appreciation to all health workers. Thank you so much. And with that, would like to pass to Fadila and see you in our next presser. I think we have tomorrow the Global Preparedness Monitoring Board. I think we have a special event tomorrow. Thank you, Fadila.
Thank you, Dr. Tedros, Mr. Hunt, Mr. Ryder, and to our colleagues for your valuable contribution, and not to forget journalists for their regular attendance and presence. I now close this press conference and remind you that you will receive the audio file of this press conference and Dr. Tedros' remarks. The transcript will be available in the course of the day. I apologize to those who could not get their questions answered. Thank you so much. Au revoir.